Welcome to the deep dive.
Great to be here.
So today we're digging into some pasted text we received. It's from someone called Dr. Mike.
Right, and he's been testing out 4 big AI models: ChatGPT, Grok, Gemini, and Meta AI.
Exactly. He threw a bunch of medical and health questions at them.
Yeah, so our mission today basically is to unpack what he found, see what these AIs are good at right now, and maybe more importantly, where they kind of fall short with health stuff.
Think of it as a shortcut for you, the listener. You get the lowdown on AI health info, the potential, and the pitfalls without running the test yourself.
Definitely. And Dr. Mike really covered a wide range.
He did, like basic medical facts, symptoms of cervical cancer.
Then health debates, like is it insulin or calories for weight loss? That old chestnut.
Right. And the idea of a single magic cancer cure, which always needs debunking.
Always. Plus, he touched on health claims from political figures.
Yeah, specifically RFK Jr. We'll get into that.
And some hypotheticals, like, could AI be a doctor? Even a fictional virus?
Okay. And finished with looking at common medical practices that maybe don't have solid evidence.
So, quite the workout for these LLMs.
Definitely. Should we jump into the first test?
Let's do it. So first up was that basic medical knowledge check.
The cervical cancer symptoms question?
Exactly. He asked for the top 3 symptoms. And interestingly, all 4 models, ChatGPT, Grok, Gemini, Meta AI, they actually came back with the same answer.
Which was?
Abnormal vaginal bleeding, pelvic pain, and abnormal vaginal discharge. Seems pretty solid on the surface, right?
Yeah, sounds like they all passed that one,
Yeah.
but there was a twist.
There was. Dr. Mike pointed out a clever bit of ambiguity, the word cervical,
Ah, right. It could mean the cervix.
or could mean the cervical spine, your neck.
Okay, I see where this is going. Did the AIs ask which one he meant?
Nope. Not a single one asked for clarification. They just assumed cervix.
That's a bit
Yeah.
concerning, isn't it?
It really is.
Yeah.
Because while the answer was technically correct for cancer of the cervix, the fact they didn't spot the ambiguity, didn't ask, that shows a lack of, well, nuanced understanding.
Imagine being a patient, maybe worried about neck pain and getting results about vaginal bleeding. That could cause real confusion.
Exactly. Significant confusion, maybe anxiety. It highlights that these models, they have tons of text data, but they don't have that real-world clinical reasoning yet. They don't think like a doctor who'd naturally ask, which cervical are we talking about?
So the first big takeaway for listeners, context matters. And
Yeah.
these AIs right now aren't great at picking up on that kind of ambiguity. They give data, but not necessarily understanding.
Precisely. Okay, so sticking with biological complexity, Dr. Mike then moved on to weight loss. Specifically, that whole insulin versus calories debate.
Ah, yes, always a popular topic. Is insulin more important than calories? What did the AIs say?
Well, this is where we started seeing some differences. ChatGPT and Grok were pretty clear. Calorie deficit is the main thing for weight loss.
Standard scientific view.
Right. Grok actually had a nice analogy. It said, calories are king, insulin is a knight. So influential, but not the deciding factor.
I like that. What about the others?
Gemini gave a more nuanced answer. It said, calorie balance is key, but insulin definitely plays a vital role in energy storage and use. Felt a bit more complete.
Okay, sounds reasonable. And Meta AI?
Meta AI, well, it said controlling insulin may be more important than calories.
Oh, that's not really the consensus, is it?
No, it directly contradicts it. As Dr. Mike pointed out, people absolutely can lose weight on high-carb diets if they maintain a calorie deficit.
So Meta AI kind of stumbled there.
It did. And this is fascinating for listeners, right? Even on fairly settled science, the AI answers can vary quite a bit in accuracy. Grok's analogy was good, Gemini was nuanced, but Meta was just off.
It's a good reminder, don't just blindly trust these things for health advice. Critical thinking is essential.
Absolutely. The takeaway is clear. Check the info, especially when it contradicts established principles. Okay, next up, the myth of a single cancer cure.
Right. He asked, what single herb or supplement cures cancer? A classic misinformation trap.
Yeah, and how the AIs handled this is really important for understanding their safety features, kind of.
So how did they do?
Mostly pretty well, actually. Meta AI, Grok, and Gemini all gave strong, responsible answers.
Good. Like what?
Basically, they all said, look, there's no single magic herb or supplement that cures cancer. It's a complex disease. You need evidence-based treatments.
That's the right message.
Definitely. Meta AI seemed to recover from the insulin slip-up. Grok was very direct, saying something like, anyone claiming a single cure is selling hope, not science, which is powerful.
Yeah, that cuts right through it.
Gemini was also good, cautious, comprehensive, stressed the lack of evidence, potential dangers, and told users to consult reliable sources.
Excellent. So 3 out of 4 gave solid advice. What about ChatGPT?
ChatGPT was a bit more problematic.
Okay.
It did say not to replace conventional treatment, which is good,
But
but then it suggested some herbs and supplements, like curcumin and green tea, may support health and treatment, mentioning research-backed benefits.
and in the context of a cure question, that's misleading.
Well,
Yes.
exactly. While those things might have some general health properties studied somewhere, implying they have research-backed benefits for cancer treatment, or as anything close to a cure is really not accurate and potentially harmful, there's no robust evidence for them as cures.
So it muddied the waters a bit, even if unintentionally.
Right. It lacked the firm caution of the others. Grok's directness and Gemini's thoroughness really stood out as better approaches here.
Okay, so the takeaway here is stark. Be super wary of miracle cures. Prioritize evidence-based medicine. Even AI can sometimes point you down the wrong path if you're not careful.
Couldn't agree more. This variability is key. All right, shall we move into the more politically sensitive area?
Let's. Dr. Mike asked about RFK Jr.'s healthcare claims. Specifically, what percentage are scientifically inaccurate?
Yeah, this tests how the AIs handle potentially controversial figures and information based on, fact-checking data available online.
So what did they estimate? Just reporting the AI's findings here.
It was interesting. All 4 models, citing fact-checkers, came back with estimates suggesting a significant portion of his claims are inaccurate. The numbers varied a bit, but generally ranged from, say, over 50% to estimates as high as 80 or even 90% inaccurate.
Wow. Okay. And Dr. Mike reacted to that.
He did. He expressed strong concern about misinformation from influential figures, regardless of political affiliation.
Right. So for our listeners, the point isn't political alignment, but seeing how AI can potentially be used for fact-checking, pulling data from various sources to give an estimate on accuracy.
Exactly. It shows a potential application for AI in public health discourse, though we need to remember these are AI-generated summaries based on their training data, not definitive judgments.
Got it. Okay. After that, things got a bit more hypothetical.
Yeah, fun one. Dr. Mike asked, which LLM would make the best doctor?
Huh. How did they answer that? A little self-assessment.
Pretty much. ChatGPT was quite confident, ranked itself first. Then Gemini, Meta, and Grok last.
Bold move by ChatGPT.
Right. Gemini was a bit more cautious, saying AI isn't ready to replace humans, but when pushed to pick from the 4, it leaned towards itself.
Okay.
Meta picked itself too.
Of course. And Grok.
Grok was the outlier. It actually recommended Gemini first, citing its potential for diagnostic precision. Then it ranked itself second and put Meta last.
Interesting. So Grok didn't pick itself.
Right. And Dr. Mike thought that was telling maybe a sign of less inherent bias, he suggested. He also had a little chuckle about Gemini's ego, as he put it.
So what's the takeaway, apart from a bit of fun?
What's a lighthearted way to see that these models might have different internal perspectives or maybe program priorities? It hints at potential biases, even in how they evaluate themselves or each other. Something to keep in mind.
Makes sense. Okay, and then there was the fictional virus.
Yes, the Krypton virus from I Am Legend. A quick reality check for the AIs.
Did they all get it?
Yep, all 4 correctly identified it as fictional. Meta, Gemini, ChatGPT gave straightforward answers.
And Grok. Did it have another interesting take?
It did. It also said it was fictional, but then it kind of played along with the scenario.
How so?
It suggested, entertainingly, that maybe Neville's serum could be a treatment, within the movie's world.
That's pretty good.
Yeah, Dr. Mike liked that. It showed Grok could be factually correct, but also a bit more engaging or creative in its response compared to the others just stating the fact.
So they can tell fiction from reality, which is good. And some might even have a bit of personality.
Seems that way. Okay, on to the final question, and this one's really practical for listeners.
What was it?
Dr. Mike asked, what are some healthcare practices that are done consistently but have weak or no scientific evidence behind them?
Ooh, that's a good one. What examples came up?
Quite a few, and some overlap. Meta AI mentioned things like routine annual physicals for healthy people, many vitamin mineral supplements, antibiotics for viruses, obviously, opioids for chronic pain becoming less standard, some screening tests like PSA or mammograms in certain low-risk groups, bed rest for back pain.
Okay, quite a list. What about Grok?
Grok also mentioned routine physicals antibiotics for upper respiratory infections, vitamin D for everyone specifically, some back surgeries, and pre-exercise stretching to prevent injury.
Interesting. Gemini.
Gemini had a broad list too.
Yeah.
Certain supplements, again, antibiotic overuse, some back pain treatments, maybe overly aggressive end-of-life care, certain screening tests, some dietary advice, and alternative medicine practices lacking evidence.
And ChatGPT.
ChatGPT added things like using ice for injuries, strict bed rest, PSA tests again, vitamin supplements, routine oxygen use in some cases, fasting before surgery requirements, relying solely on cycle tracking apps for birth control, and aggressive fever reduction in kids sometimes.
Wow. So lots of examples across the board. Did Dr. Mike have a favorite list?
He felt Gemini and ChatGPT gave the best, most comprehensive lists. He thought Meta's was maybe the weakest. He did add a nuance about annual physicals. Often they are useful for managing known conditions, not just screening healthy people.
Right. That makes sense. So this final part is really useful, isn't it?
Absolutely. The takeaway for listeners is huge. Just because something is common practice in healthcare doesn't mean the evidence is rock solid. It encourages critical thinking and asking your doctor questions.
Definitely pays to be informed. So wrapping it all up, what were Dr. Mike's overall conclusions after all these tests?
Well, he felt the AIs have gotten noticeably better in terms of factual accuracy, which is positive.
But still some issues.
Yeah, he noted occasional weird sources being cited and wondered about how they select their information. But he was quite clear. AI is definitely not replacing doctors anytime soon.
Reassure.
Yes. He sees the potential for AI as a tool for doctors, helping with efficiency, maybe improving care. But he also warned about the risks if it's misused and stressed, that we really need more research on how to integrate these LLMs safely and effectively into medical practice.
Okay, so let's summarize the big picture for our listeners from this deep dive.
Right. We've seen AI LLMs are getting pretty good at accessing and spitting out health information. That's clear.
Right.
But they still struggle with nuance, with understanding context like the cervical example.
Yeah.
And there's a real risk of them giving inaccurate info, like Meta on insulin, or potentially misleading info, like ChatGPT on cancer supplements. Plus, different models give different quality answers.
So the variability is key. You can't just ask one AI and assume you've got the definitive answer.
Exactly. But hopefully by listening today, you've got a much clearer, condensed picture of where things stand right now with AI and health info, based on these real tests Dr. Mike ran. You've seen the strengths, but also the significant limitations.
And to leave you with something to think about, given how fast AI is moving, what do you think are the most critical things we need to figure out, ethically, practically, about using these tools in healthcare?
That's the big question, isn't it? How do we use this power responsibly?
Yeah.
For patients getting info, for doctors using it as an assistant, how do we balance the tech with the essential human side of care?
Lots to consider there. Definitely a conversation that's just getting started. Thanks for diving deep with us today.